Good evening and welcome to Beyond the Front Page, a public affairs show brought to you by Community College for the spring 2021 semester here at the college, as well as shown on Spectrum, Verizon, Fios, as well as the Auburn Regional Media Access, better known as ARMA, and WIN 89.1, the college's radio station. I'm your host, Guy Cosentino. In 1971, East Hill Medical, which is now celebrating its 50th year in Cuyahoga County, opened up its doors on James Street, but it started by some ideas 5 years before that in 1965 when a small steering committee got together to talk about women's health and the issues surrounding that and also access. By August 1970, their efforts resulted in the opening of Cuyahoga County Family Planning Office, which was located on James Street, as I mentioned, in Auburn. And over 5 decades, the organization has evolved with a new name, new mission, or multiple missions, and changed some of the services that they provide. We have in our studio today Keith CUTTLER, who is the Executive Director, and I should say President and CEO of East Hill Medical, to talk to us about what is going on at Metcalf Plaza and North Fulton Street, I'm sorry. We have him on to discuss the agency and their 5 years of service. Welcome.
Thank you.
Happy anniversary.
Thank you very much. It's exciting.
So for those who may not know, what is East Hill?
That's a really good question. It seems simple, but it's a fantastic question because it's not like anything else around the area. So we're a primary care office, we're a dental office, we're a reproductive health office, but we're a federally qualified health center, first and foremost, which is essentially a designation that the federal government gives to community-based health centers to ensure that they provide access to quality care for everyone, regardless of ability to pay. East Hill is also licensed under Article 28 of the New York State Public Health Law, the same public health law that licenses hospitals, as a diagnostic and treatment center. So it's a very particular position within an organization that has the focus originally on caring for those who may not have access to care.
And we'll talk about your sites and all that,
Yeah.
but just let's take the federal designation right now. That has involved you knee-deep, to say the least, in COVID.
Absolutely.
And dealing with that, so both from the idea of your own staff making sure they're inoculated, but also dealing with the general public. So you're administering vaccines now.
We are.
Any idea how many you've done since I think it's been a month and a half now, maybe 2 months.
Yeah, we applied for our first dose in December, really, shortly after the emergency use authorizations were given to Pfizer and then Moderna. We didn't know at that time which vaccine we were going to get. There was thinking that maybe we would have a choice. It was not a hard choice to make, since Moderna you can stick in a regular freezer or refrigerator, and Pfizer ultra cold refrigerator that would have cost us in excess of $6,000 to purchase. As it turns out, we didn't have to choose. We were just given the Moderna vaccine. So we've been getting vaccines since December, and we've vaccinated well over 1,000. Our patients, our employees, and mostly in the community. We've really focused in the community on those hard-to-reach patients. We're focusing now on homebound patients. We're focusing on the elderly.
So are you doing home visits?
We are.
You are. So is someone, if I was 70, and I'm not, but if I was 70, could I just walk in to Metcalf Plaza and ask for the vaccine?
No, you cannot.
Okay, so how do you qualify if you come to your office?
So New York State has their 2 eligibility lists, 1A and 1B. Most vaccine providers are restricted within those 2 eligibility lists as to who they can vaccinate. It's a coordinated effort at the state level to say, this is how we want our vaccinators to approach the populations, with the exception of federally qualified health centers who can vaccinate anyone on both of those lists. So as long as you're eligible according to the 2 lists as they exist today, you can get a vaccine. The reason you can't come into the center at any time and get a vaccine is because they have limited storage capacity. Once you puncture a vaccine or a vial for vaccines, you have to use it within 6 hours.
So from a planning
From a planning standpoint, we have to group all of them together into clinics.
So if you had, COVID has obviously impacted your 50th anniversary, and we're going to talk about that.
No question.
About that, because I'm sure when you were planning this in January of 2020,
I had no idea.
No idea.
Right.
Has COVID, for your operations, you obviously have a staff, how large a staff?
About 57.
So you have 57 individuals there who work on multiple sites. What steps have you had to be taking to deal with COVID? And I'm sure there's an expense side to that as well.
A tremendous expense. So it's cost the organization both in expense to provide supplies that were desperately needed. You wouldn't like to think of this that there's price gouging, but prices definitely went up with a shortage in supply of PPE.
When you had states
and other things.
basically looking to see if they could get sideswipe the federal government.
Yes.
So,
Yeah.
or go, I shouldn't say sideswipe, go around the federal government.
Right. But it's also cost in terms of lost revenue. People stopped coming in for visits. People were afraid.
Is that one of the bigger challenges for your organization? Because it's tough enough to get to people to go to a doctor to start with, and you've added some new staff, and we'll talk about that. But one of the big issues that health providers seem to, if you take Dr. Fauci, who was talking about public health and, wear masks, do all the things that you need to do to stay safe.
Right.
There were other health providers saying, come in the door. You still need to get your blood pressure checked. You still need to do cancer screenings and all that. How big a challenge has that been for your staff?
Very hard. In particular, you have the chronic diseases. Diabetes is probably one of the ones that really surfaces to the top. If you're a type 2 diabetic, you're not checking your blood sugars, you're not getting your hemoglobin A1C drawn every 3 months, you can run into all sorts of other problems. So we did experience that, delays in cancer diagnoses because people weren't coming in with common complaints that they had no idea, would ultimately result in a diagnosis of cancer. But an interesting one has been pediatrics. Parents have been slow to return to the office. Very early on, we converted to telemedicine, as most providers have now. We already had everything in place for telemedicine. We had the equipment, we had the policies, we had the procedures. So for us, it was more like flipping a switch. We were ready to go. And we started doing telemedicine visits weeks before anybody else got around to it. Just happened that we had prepared for that and had that in our long-term plans anyway. So that was helpful to reach some folks to do these telemedicine visits who, you didn't want coming in if they presented with certain diagnoses. Like, I think we can talk to you over a video and really assess your situation and then decide whether you should come into the office.
Which is its own hump, whether they even have access to that, let alone whether they trust, why would I talk to you by video?
Right, yes. For many of our patient population, particularly in the more rural areas of the county and surrounding counties, there's no computers in the home. There's a cell phone. It's a smartphone, so they can do a video visit on a smartphone, but I've heard stories anecdotally that large households shared 1 or 2 phones, and if your appointment was that day, but it wasn't your day for the phone,
you missed that appointment.
You missed that appointment. Others, buy time, buy minutes for their cell phone service and thought that their medical visit was not a priority to buy minutes for. So there were
Candy Crush might have been, but not.
Candy Crush might have been.
So have you also had to take steps? So all of your staff was able to get vaccinated back in January?
Yeah, we were able to vaccinate our staff fairly early on in the process, first round.
And East Hill has faced this before. Jessica Souls, who works in your office, was very nice to provide some great history. I would say East Hill adapts to changing times.
We do.
We'll talk about dental in a little bit. But back in the 80s, you were one of those providers who tested people who thought they might have been exposed to the AIDS virus. And so is your planning, you're the president and CEO, yeah, there's day-to-day operations that you got to make sure the doors open and the computers work and the copiers plugged in and all that, so I get that.
Right.
How much is long-term planning and looking for the next, not necessarily opportunity for revenue, though that's a point of it, but what's the next crisis going to be? Health crisis.
Right. The trick is to anticipate what that is. Now, you can't anticipate specifically what the next crisis is going to be. Certainly no one anticipated SARS-CoV-2 coming. We thought H1N1 was tough, but it pales in comparison. So you can't anticipate the specific event, but you can do certain things within the organization to prepare it to adapt and to react to these types of crises when they do come up. You know, it's adequate staffing, it's having inventory supplies on hand, especially those that, you know, don't expire.
Right.
You can keep those for long periods of time.
Who would have ever thought N95
Right.
masks?
Right, no one. Overflow, you know, we practice all the time for crises in the community. We are an overflow site. For instance, if the hospital had a shooter on site and needed to evacuate some folks from the hospital, we are one of the sites that they would bring.
And that's because of your
patients to.
federal designation?
The state designation
State, yeah.
as a diagnostic treatment
So
center.
let's get into some real estate first
Yeah.
and then go to other things. You have 2 sites?
We do.
Where are they?
They are on Genesee Street in downtown at 144.
So that's the old Metcalf
That's
Plaza.
the Metcalf Plaza.
And if I saw the other night, I don't know if it's finished, but you have a display going up in the old real estate office.
We
in the corner.
do.
Is it up in?
It's up.
It's
and
up.
You should visit it. It's
So
really
if
exciting.
you go by the old Metcalf Plaza, it will always be known as the Metcalf Plaza,
know.
by the way. And
I gave up that fight years ago.
well, Senator Metcalf was just a terrifically nice man, and I think it'll always be known as that building.
Yep.
But if you go downstairs in what was the real estate at the corner of Genesee and Williams,
Yep.
you have a display there that people could drive by and walk by.
We did. We do. We took an empty space, a recently emptied space that was held an insurance company that had moved out,
Oh, okay.
and we converted it to a 1970s era physician exam room. You know, we had conversations about, well, look up Marcus Welby and pictures from that show to find out, because there are a few.
There's
that
some
don't
equipment
remember
in there
Marcus
that,
Welby, you know?
that will mostly have to have good descriptors on there.
Yes.
So you have that site, and then you have what was originally moved into, and I want to say in the 80s, was the East Hill site on North
Fulton Street, right.
And so what operates downtown and what operates on East Hill?
Downtown is the administrative offices, our dental offices, adult primary care, and the family planning and reproductive health office. Those are the offices that we have downtown. On North Fulton Street, we have pediatrics in the upper level, which is actually street level from the front.
Right.
And then down below, we have Duckett Family Medicine, which is our newest practice site.
So you've added Adam Duckett.
Yes.
He has come, and he joined what, in November? In the
October,
fall.
yep.
In the fall. So what is he practicing?
He's practicing family medicine for patients 15, 16 years of age and up.
And so is that part of East Hill, or
It
is he
is.
a tenant of yours?
No, it's part of East Hill.
And then you've, and I'm sorry, I apologize right from the beginning. I'm likely going to mess up her name. But you have Dr. Wanting, who just joined you part-time, correct?
Yeah, Dr. Watting came from, she was practicing in Elmira. She and her husband relocated to the Ithaca area.
He has a job at Cornell or something.
Right,
if I
right.
remember.
So she started practicing with us as a pediatrician in January of this year, 3 days a week, and with the intention of hopefully by the end of this year going to full-time.
Do you see, I know this has been the mode of Auburn Community Hospital where they're buying practices. Is that something you're looking at as you add services?
Yes, I would prefer not to acquire the practices, but we have plans to expand both in geographic reach and services that we offer. So that's part
Outside
of
of
what we'll
Cuyahoga
plan.
County, or
Potentially, yes.
outside? Where are you looking?
I did have quite a few conversations with a gentleman who was looking to have a 5-year retirement plan by associating,
okay.
instead of being an independent practitioner, associating with an organization in Onondaga County. It was actually in Liverpool.
And one of the challenges that we don't think about when we walk into a doctor's office is all this behind-the-scenes stuff with
Right.
billing. And doctors hate billing.
They have to, yeah. It's part of the job description, I think, to
Gotcha,
hate
okay.
billing.
So on an annual budget, you have 57 employees. How large is your budget annually?
About $8 million.
And where does most of that money come from?
It comes from patient billings with insurance companies. So about 2/3 of our patients are Medicaid, and the rest is comprised of about 5% Medicare and the rest commercial insurance.
So the real reason you're here is to talk about 50 years. So I do want to go
Right.
through some history here. It was not always East Hill Medical.
No.
So what came about in 1965, 1967? Not that you were there.
Right. This was probably the most fascinating thing that I've run into since I arrived at the organization in 2016. We started out by thinking about a celebration for the year in the way that a lot of organizations have these types of celebrations, perhaps a big gala, fundraising involved with it, a single event celebration. And of course, when the pandemic hit, we needed to switch gears pretty rapidly. So we converted to a virtual celebration, if you will, with the exception of the actual physical exam room from the 70s. And we wanted to dive into the history of the organization. A lot of the staff have been with the organization 10 years or less. My executive assistant is the exception. She's been with us 37 years. Okay. And we rely on her a lot for older information.
She is clearly the institutional memory.
No doubt. And she's terrific. But we really wanted to understand, how did this organization evolve? It's 1971. What happened? How was CUGA Family Planning created? And to me, that's utterly fascinating. You had mentioned a group of concerned women in 1965 having conversation, getting together and saying, we see a lot of stress in households because women are having babies too close to each other. And that was the genesis of the organization, is those conversations in the mid-60s.
There was a time when people were having 6, 7 children, and sometimes literally in a row.
In a row.
I'm not going to say Irish
almost
twins,
continuously pregnant.
You know, we're on the verge of St. Patrick's Day, but I won't say it that way. But no, literally in that. So they got together, and it took them about 5 years to figure out a plan. So what happened in 1970, 71?
So at that time, they had, it wasn't just a committee for 5 or 6 years. It kind of grew. So it was first not even a committee, just a group of folks talking. Then they form a steering committee, and they understand the problem more. They understand that women having babies too close together was causing financial stress. Remember, 1965 was largely one income per household rather than two. So it was financial stress, it was physical stress. It was really detrimental in their opinion. So as they progressed with these conversations and moved into what can we do about this? Ultimately, the Family Planning Center was conceived, and
no pun intended.
No pun intended, yes. And we're off to the races in terms of providing these types of services. So focusing on contraception, focusing largely and most importantly on counseling and education, really understanding what was going on in the household and working with the individuals.
In some cases, the contraception issue, because I know one of the great supporters, if I remember correctly, was George Michaels, who was a deciding vote about abortion rights in New York, which led to the Supreme Court in the 1970s. But contraception was a dirty word.
It absolutely was.
And so this became the outlet, so to speak, for people to deal with these issues.
Right. And I think that's what's most important. What's really gratifying to me is how we've been able to keep that original mission for 50 years.
So you're still doing that. So if you had a way to identify who gets those types of services, is it a broad spectrum? Is it a narrow narrow population? Who receives those original services today?
It's really a broad spectrum. Yeah, it crosses all socioeconomic classes. You really can't pinpoint, demographically or through a socioeconomic class in the community who receives those services. It's people who are interested, and it is one of those things that's not routinely provided by your primary care physician. It's that extra little thing on the side that you may feel uncomfortable talking to your primary care doctor about. He or she may not have the time or the depth of knowledge and experience.
Or may see other family members that you don't want.
Right.
You have this worry that they're going to spill the beans.
Exactly.
So your original office was where? James Street?
James Street, yes.
And then you moved to North Fulton Street.
Right.
When did it change from Cuyahoga County Family Planning to East Hill?
To East Hill in the 90s. So that the Fulton Street location was the only location at that time. And it was obviously located on East Hill, what we all refer to as the East Hill area. So they adopted that name of East Hill Family Medical.
And you bought, you weren't with the agency at that time, but you bought the building downtown in 1996.
Correct.
There. And a little bit about the makeup. You're a not-for-profit. You initially weren't, which I was interested when I went to your website.
Is that interesting?
I was interested that you weren't initially a not-for-profit, which is interesting just from a lot of different perspectives,
Right.
liability and everything that goes there. But you do have a board of directors, I'm assuming?
We do.
How large is it?
We have 10.
And are they mainly local people? Are they medical professionals? Where do they cross?
No, they're local, and the federal regulations that come along with being a federally qualified health center mandate that at least 50% of your board members must be patients of the organization or parents of patients.
Or parents, okay.
Right.
So over this time period of, let's say, 1970, 1971 to today, are there services that your agency got rid of?
No, it's always been adding on.
Okay.
Yeah.
So you joined, and if you don't mind, I'd like to talk
Sure.
a little bit about you, because you're the face of the agency. You joined in 2016?
Correct.
Where'd you come from?
I have spent, at that time, more than 30 years in healthcare. Worked mostly in hospitals. Did work for an insurance company for a short period of time. Escaped from that because of mergers and office closures.
Gotcha.
That happens a lot in that world. So, but I was always drawn to the provider side of healthcare.
So what's your academic background?
I had a bachelor's degree in psychology from Syracuse University. Just kind of fell into, my first job was at Benjamin Rush Psychiatric Hospital in downtown Syracuse. Professor I was working with on graduate work said, I want you to go get some real world experience. I'm going to hook you up with a job down at the psych hospital. And that was it. Never looked back.
And when you came aboard, and maybe it still is, what has been your biggest priority?
Biggest priority for me has always been in healthcare, and is making sure that everybody gets really outstanding care. One of the things that frustrates me in healthcare, and has for a long time, is that those who are less fortunate, those who have difficult time accessing healthcare, are often relegated to smaller, ill-funded organizations who have dilapidated offices, old office equipment, and that drives me crazy. It
So
doesn't
what's the
matter to me.
So what's the biggest challenge for you to how do you overcome that?
The biggest challenge with that is A, reaching them and bringing them in. And
Transportation.
Transportation is a huge issue, especially in Cayuga County. where
Long, rural county, tough to do that.
very, very difficult to traverse, and lack of public transportation in this community really makes a big difference.
So your staff wanted to celebrate 50 years.
Yeah.
COVID, you said, kind of knocked you for a loop back in March. It's been a year ago
Been a
this
year.
week.
Mm-hmm.
So what has changed in your planning? What are you doing besides the display on the first floor, and besides some of the stuff you're doing on the website? What are you doing to celebrate?
What we did really is say we went along with what everybody else was doing and what we were doing with patients, and we went virtual. So a series of videos, and we're using the 1970s office as our set for videos, telling the history and the story of the organization. And it was Jessica that really coined the term 50 years of impact, and I think that's a fantastic term. It really says we've been here for a long time and we've had tremendous impact in this organization. Let us tell you about it. Get to know East Hill and how it got to the point it is today.
You did bring up a point that occasionally when somebody celebrates a milestone, you do fundraisers and all that.
Right.
Has that been postponed, or have you canceled them outright?
Not sure yet.
It really gets to depend on how many people get the vaccine.
Yeah,
Not
where we go.
through you.
Not through us, no.
But overall.
Can't reach herd immunity just through East Hill.
But something might change.
It could. I'm
by the
hopeful
fall.
that it will change. We started a foundation not too long ago, the East Hill Medical Foundation, to be able to start assuming those responsibilities for fundraising and outreach on that aspect, so the folks at the medical center can continue to focus on what they do best, and that's deliver care to everyone. That's kind of been dormant. Everything's really push pause.
So most people most likely don't even know they come into contact with East Hill Medical through their children. So you have a dental program that's in school. First of all, can you tell us what that is?
The school dental program. We have an arrangement with the Auburn City School District and several other school districts to actually go into the schools.
3 or 4,
Yeah.
4 districts?
I think it's
Okay.
4, to go into the schools and provide basic dental care to the students there. In certain pockets of the area, dental care is very poor.
So we've done a lot of, I think we were talking on the way down, we've done this for some time. One of the items that we had done a number of shows on before you were here was this whole issue of the lack of dental service availability.
Yes.
In this community. And I know your agency came up, they had a charity event maybe 15 years ago, CHAIR, small ITY, where they sold chairs. I think I have at least 3 of them
Oh, do
somewhere
you?
through
Good for you.
our house. But in doing that, you did some public ad campaigns and public health announcements. How big is the lack of access to dental services in our community, which still does have a high poverty rate?
It's extremely significant. We are one of only 2 dental providers in the county that accepts Medicaid.
Say that again.
We are one of only 2 dental providers that accepts Medicaid.
And we all know that there are offshoots to bad dental health that
Yes.
have a cascading effect on individuals.
Without question.
Why hasn't that changed?
I don't know why others won't. Medicaid reimbursement is typically low in New York State.
Okay.
It's very low, and it varies by state where that reimbursement level falls. Because we're a federally qualified health center, we receive an additional amount of money per visit for a Medicaid patient from the state of New York. Medicaid, as you know, is now paid by private insurance companies. They've privatized almost all of Medicaid. So we receive payment from the private insurance company, and then we also receive payment from the State Department of Health through Medicaid as an additional supplement.
So would you still, I think when we had individuals from your agency on, let's say 10 years ago, whenever they were doing events, is it still, as far as you're concerned, a public health crisis?
Without question.
And when you go into schools, and I'm a little familiar with this because one of your employees I know very well, do you charge? You don't charge little Sally who gets in a dental chair.
Absolutely not.
So what happens to little Sally when she goes into a dental chair
In the schools,
in a school?
we do fluoride varnishes, sealants. Sealants is a big program. It's really initially in the 2nd, 3rd grade
Right.
level cavity prevention. Oftentimes, though, the mouths are not in good shape by the time we get to them, so there's treatment and then additional services for prevention.
So I want to finish up. We have a minute or 2 left.
Mm-hmm.
What do you see 10 years from now for East Hill?
I see an organization that is much more broad in terms of service offerings, primarily in the area of subspecialties that are difficult to come by in smaller and rural communities. It's sometimes really difficult to attract physicians to a community like this when they're so subspecialized, and often people have to travel tremendous distances. I see an organization that's following the trend of federally qualified health centers nationwide, and that is becoming more and more integral into the delivery of care in every community. Something in the neighborhood of nearly 2 out of every 2 out of every 9 people now in the country get their primary care from a community health center. And that's only going to grow.
Does that mean that, and there's a cost with this, so there's a flip side to this. Does this mean more satellite offices?
Mm-hmm.
Again, we talk about a long and narrow county. You might be talking about Onondaga County in one practice, but whether you're down in Summerhill or Sterling, how do you get to see those individuals? Is there a role that you see? We're not in the George Jetson world, which
Right.
we might have thought about when we were kids. Is there a role that you see East Hill expanding into those areas in the next 10 years?
Yes. And for me, I believe the direction of healthcare, and appropriately so, is to not continue to demand that the patients come to you, but to go to the patients. It's almost full circle back to house calls.
Okay.
With the exception of the fact we're not going to have house calls, we're going to have small pods or satellite offices in various places that staff will rotate in and out of. I think it's incredibly important, particularly in upstate New York, that we bring the health care to the patients rather than vice versa.
I know we're talking about the 50th anniversary and your celebration, but
Yeah.
I'd love to have you come back on to talk about that big picture
Oh, that'd be great.
issue of what East Hill sees as the pockets that we have that
Mhm.
are underserved, but also where there are opportunities out there in healthcare.
Be glad to do it.
Happy anniversary.
Thank you.
Our guest has been East Hill Medical's President and CEO, Keith Cutler, to come in to talk about the services that his agency provides, as well as talk about the 50th anniversary. I do encourage you, it is weird to see that corner
I know.
display, but it's very cool.
Yeah, it is.
To see how far we have come in the area of healthcare. This Tuesday, we'll take up the issue of the increase in overdoses in the last several months of opioids and other drugs with Healing Community Studies Project Director Monica Selvage. She'll be in here to talk about that. Next Thursday, the 18th, we'll have Port Barnes Superintendent of Schools, Neil O'Brien. He is Cuyahoga County's most senior member of the superintendent's group, the dean there. He'll talk about his service in this community as he retires at the end of this academic year. In the next couple of weeks, we'll have Assemblyman John Lamondes here to talk about Albany and the budget that will have been hopefully passed by that day, City Manager Jeff Dygert, as well as the Community Action Agency's Family and Victim Services Director Frank Barwinczak, who will discuss the spike in local domestic violence incidents, unfortunately. And then, of course, we're trying to plan out a Zoom forum for the candidates for the Auburn Large School District. That'll be on April 27th. I'll be moderating those sessions. Jeremy Boyer, the executive editor of The Citizen, as always, will be asking those questions. Before we go, though, we would like to let you know that you can send us your ideas for shows and guests or questions for those guests at cozguytho@aol.com or Inside Government or Beyond the Front Page at 141 Dunning Avenue, Auburn, New York, 13021. I'm Guy Cosentino for Community College. We want to thank you for watching. We hope you have a good night. Have a great tomorrow and be safe out there. So other than